Good evening everyone. Today is 28th of July 2025. It's 8:30 p.m. here. It's Monday. So in this video I'm going to read Lambert Eaton Syndrome, Lambert Eaton Myasthenic Syndrome from Yanoff. Excuse me for my sore throat. I really wish someone please develop this software which can read like these audio files for me, because I'm just making these videos for me, but at the same time if other people are getting benefited listening to these, because I'm not coming across with any software that can convert these PDF files into audio files for me, so that, and also with the speed adjustment, so that I can just read them with the comfortable speed. So excuse me for my sore throat. So Lambert Eaton Myasthenic Syndrome. Introduction. First described in 1953 as a child of muscle weakness, autonomic dysfunction and hyperreflexia. The Lambert Eaton Myasthenic Syndrome (LEMS) shares clinical features with myasthenia gravis. Unlike myasthenia gravis, LEMS is a presynaptic disorder of neuromuscular transmission affecting voltage-gated calcium channels (VGCC). This rare disorder is associated with a malignancy such as small lung cell carcinoma (SCLC) in at least 50% of the cases. Symptoms of Lambert Eaton Myasthenic Syndrome typically precede the diagnosis of the neoplasm. Epidemiology and pathogenesis. Median onset of the paraneoplastic form is around age 60 years. Smoking is a risk factor because of the high association with bronchogenic carcinoma. About 3% of the patients who have small cell lung carcinoma have LEMS, that is Lambert Eaton Myasthenic Syndrome. The non-neoplastic form is associated with pernicious anemia, thyroid disease, Sjogren's syndrome, and other autoimmune disorders. Myasthenia gravis and LEMS may occur concurrently. Now, pernicious anemia, we know that autoantibodies are formed, so there is a vitamin B12 deficiency, its absorption is defective. And then Sjogren's syndrome, in which there is dry mouth xerostomia, dry eyes, keratoconjunctivitis sicca, bilateral chronic desiccation of conjunctiva and cornea, known as keratoconjunctivitis sicca. Then arthritis. This is the triad of Sjogren's syndrome, characterized by SSA, SSB antibodies, that is Sjogren's syndrome A and B antibodies. And other autoimmune disorders, myasthenia gravis and LEMS may occur concurrently. Symptoms are caused by impaired release of acetylcholine from the nerve terminal. End plate potentials are too small to generate an action potential. Striated muscle, glands and smooth muscles are affected, unlike myasthenia gravis, in which only skeletal muscles are affected. In Lambert Eaton Myasthenic Syndrome, along with the striated muscles, glands and smooth muscles are also affected. Calcium and gonadin increase neurotransmitter release, which results in improved strength. So what happens? These calcium and gonadin molecules, what they do, ions, what they do, they increase the neurotransmitter release. Ocular manifestations. In contrast to myasthenia gravis, ocular manifestations are not prominent. So in Lambert Eaton Myasthenic Syndrome, ocular manifestations are not very prominent. There are so many other systemic manifestations too. But in myasthenia, 90% of the cases it starts with the eye symptoms, and like isolated eye symptoms in 90% of the cases initially. So it is not so in case of the Lambert Eaton Myasthenic Syndrome, though there is a muscle weakness, but along with the muscle weakness there is smooth muscle weakness and autonomic nerve dysfunction. Glandular secretions are affected in Lambert Eaton Myasthenic Syndrome, which is not seen in myasthenia gravis. So yeah, so what is prominently seen in Lambert Eaton Myasthenic Syndrome? It is the keratoconjunctivitis sicca, decreased lacrimation, that leads to keratoconjunctivitis sicca, which is The predominant ocular complaints, so hypocholinergic activity, lacrimal gland, the parasympathetic stimulation leads to release in the acetylcholine lacrimal gland, and it leads to tear production, and that is affected in this syndrome. So there is a bilateral chronic desiccation of the cornea and conjunctiva, and that is called as character conjunctivitis sicca. So yeah, and that is the predominant ocular complaint in Lambert Eaton Myasthenic Syndrome. Ptosis and intermittent diplopia may occur. Sluggishly reactive pupils and tonic pupils are infrequent. Sluggishly reactive pupil, cholinergic activity, what it does, it is responsible for constriction of the pupil, accommodation reflex, and so these are absent in case of the Lambert Eaton Myasthenic Syndrome. And tonic pupil is what? Again, tonic pupil is edystonic pupil, means the pupil should be dilated, right? Hypocholinergic activity. So the pupil is sluggishly reactive to the light. The light reflex is present, but it is very sluggish. And then accommodation reflex, yeah. So accommodation reflex is present edystonic pupil, and it is very tonic. It's because of the aberrant nerve generation that I'll be discussing in detail. You can see the videos on edystonic pupil, what is that, to see the difference, because it is infrequently seen in this condition. I'm not going to go much into details about it, because it is the postganglionic fibers which are affected in edystonic pupil. And when postganglionic fibers are affected, there is aberrant generation of the nerve fibers, supplying the pupil and the ciliary muscles, yeah. So slow saccadic velocities that normalize after exercise have been described. So when the person does exercise, there is improvement in the symptoms, and it's not the vigorous exercise, because everyone is going to get fatigued. So it's like moderate exercise is going to, mild to moderate exercise or activity, it's going to fire those acetylcholine and calcium channels. It's going to improve the condition symptoms, but unlike in myasthenia gravis. There is one report of a patient with ophthalmoparesis and pseudoblepharospasm. One report of a patient with ophthalmoparesis and pseudoblepharospasm. Diagnosis: rapid onset and progression of symptoms over weeks to months are common in the paraneoplastic form. So paraneoplastic forms means symptoms means there is a cancer, but the symptoms are seen elsewhere which are not related to the location of the cancer. So that is because of the hormones they produce, or autoantibodies they produce, the malignant cells, metastatic cells, metaplastic cells. So that leads to these symptoms, and here the autoantibodies are produced, and that is going to cause this Lambert Eaton Myasthenic Syndrome. And 50% of the cases it is associated with if there is Lambert Eaton Myasthenic Syndrome, 50% chance is there that there is underlying lung cell carcinoma. But if there is small cell lung carcinoma, there is 3% chance that it will have the Lambert Eaton Myasthenic Syndrome. Patients generally have proximal muscle weakness, and the non-neoplastic variety has an insidious onset with mild and stable symptoms. So paraneoplastic form and non-neoplastic form. So which is more grave? It's paraneoplastic form, because there is rapid onset and rapid progression of the symptoms, acute onset of the symptoms. And in non-neoplastic variety, it's like insidious onset of the symptoms with mild stable symptoms. Patients generally have proximal muscle weakness and leg pain. Autonomic involvement is present in 80 to 96% of the cases, which results in dry mouth, constipation, hypohidrosis, decrease in the sweating, impotence, orthostatic hypotension, and urinary retention. So anticholinergic activity symptoms. So what they can be: decrease in the lacrimation, decrease in the salivation, decrease in the sweating, urinary retention, constipation, orthostatic hypotension, impotence, dry mouth. Unlike myasthenia gravis, muscle strength improves following voluntary contraction or repetitive testing, as I have mentioned earlier, maybe because calcium influx is more, and yeah, something like that. Paradoxical late elevation may occur after prolonged upgaze because of the calcium, intracellular calcium uh, uh, accumulation is more, and that leads to action potential generation. And maybe because of the exercise there is improved activity, improvement in the symptoms. The deep tendon reflexes are hyperactive or absent at rest and increase with voluntary muscle contraction. Electrophysiological studies confirm the diagnosis. Low rates of nerve stimulation. If the nerve is stimulated at a lower rate, 2 to 3 hertz, lower stimulus, it produces a decremental response. The response is not good. But high rates, that is 20 to 50 hertz of stimulation, it causes what? 2 to 10 fold increment in response, that is improvement in the symptoms and action potential. Now another test is there, that was electrophysiological study, and another test is there, single fiber electromyography study, SFEMG. It shows changes similar to those found in myasthenia gravis. Similar changes, that is jitter is produced, that is uneven spread of the action potential and the stimulus across the muscle fibers innervated by the single nerve fiber. The tensilon test result is negative. Anti-acetylcholine receptor antibodies are not present, and that is the differentiating thing. From the myasthenia gravis. Voltage-gated calcium channel antibodies are found in 85 to 90% of the patients with LAMS, and in 100% of the patients with small cell lung carcinoma with Lambert Eaton Myasthenic Syndrome. So, if the patient is having Lambert Eaton Myasthenic Syndrome, 85 to 90% of the cases, you will see these antibodies against these antibodies circulating in the blood against the voltage-gated calcium channels, which are present on the presynaptic nerve terminals. And in 100% of the cases, these autoantibodies are positive if it is a paraneoplastic form secondary to small cell lung carcinoma. Differential diagnosis. Disorders that produce proximal muscle weakness may resemble myasthenic syndrome. Myasthenia gravis usually can be excluded clinically with its prominent ocular and facial involvement. Guillain-Barré syndrome, ascending-descending paralysis secondary to viral infections like Epstein-Barr virus. Then polymyositis, enteric viricities, lumbosacral plexopathies, and polyradiculopathies can be excluded by electrophysiological testing and neuroimaging. I'm not going to go much in detail about these other differential diagnoses because we don't handle such cases. Let other people handle, because life is short and we have to focus on our field, that is eye surgery. So just as a differential diagnosis of the myasthenia gravis, because myasthenia gravis can lead to various strabismic conditions, exotropia, esotropia, double vision, ptosis, differential diagnosis of various nerve palsies. So myasthenia gravis as a differential diagnosis of it, Lambert Eaton syndrome is one of them. So let us not go much into detail about other differential diagnoses in this case, because I want to focus on main things and not extremely rare things. And we don't even deal with such things as an ophthalmologist. Systemic associations. More than 80% of the associated malignancies are small cell lung carcinomas. Other tumors associated with Lambert Eaton Myasthenic Syndrome include small cell carcinoma of the cervix or the prostate, adenocarcinoma, and lymphoma. So as a paraneoplastic form, what other cancers are associated, means this syndrome can be seen in which other cancer forms along besides this small cell lung carcinoma? It's cervix, prostate, adenocarcinoma, and lymphoma. So myasthenic syndrome may precede the detection of the malignancy by up to 7 years. So if this Lambert Eaton Myasthenic Syndrome symptoms are there, so there is a chance that the lung cancer or these cancers will be discovered after like 7 years of the onset of the symptoms. Yeah, so the symptoms precede the diagnosis of the cancer or malignancy. and rarely follows the detection of the tumor. If no malignancy is found, repeated investigations are warranted. Screening annually is very important because the symptoms precede the malignancy. If no malignancy is found, repeated investigations are warranted. Other laboratory testing includes thyroid function test because of the association of this syndrome with other autoimmune disorders. So thyroid function tests, complete blood count, Y, lymphoma association. Then erythrocyte sedimentation rate, obviously inflammatory condition, autoimmune condition, it will be elevated. Anti-nuclear antibodies, systemic lupus erythematosus, anti-Rho, anti-La, Sjogren's syndrome A or Sjogren's syndrome B antibodies to evaluate for the association, the non-neoplastic form with pernicious anemia, yes, vitamin B12 deficiency. Then thyroid disease, Sjogren's syndrome and other autoimmune disorders. Now treatment of this Lambert Eaton Myasthenic Syndrome. It's 3,4-diaminopyridine which blocks the potassium channels. So when the potassium channels are blocked, what happens? The positivity inside the presynaptic nerve terminals, it is increased, and that leads to more acetylcholine release. And it enhances the release of acetylcholine from presynaptic nerve terminals. A definite and sustained response to aminopyridines. What is that? 3,4-diaminopyridine. What it does? It blocks the potassium channels. So a definite and sustained response to aminopyridine occurs in most patients. Treatment with corticosteroids and azathioprine, mycophenolate, cyclosporin, rituximab, intravenous immunoglobulin or plasmapheresis, immunosuppressants, usually leads to improvement in strength if symptomatic treatment is ineffective. So corticosteroids, azathioprine, mycophenolate, cyclosporin, these are the immunosuppressants. Then other treatments, intravenous immunoglobulin, plasmapheresis, rituximab. So it may take several months for immunosuppressants to be effective. Anticholinesterase may be useful like what? Like pyridostigmine, neostigmine. Magnesium may worsen the weakness, so magnesium is contraindicated. One should not use the magnesium in this condition. Other medications that decrease the neuromuscular transmission should be used with caution. Treatment of the underlying carcinoma may produce improved strength. Course and outcome of Lambert Eaton Myasthenic Syndrome. The presence or absence of malignancy largely determines the prognosis. Yeah. So if there is paraneoplastic form, that is association with the malignancy, symptoms are acute and rapidly progressive. So it's obviously going to be, prognosis is going to be worse than if it is with the non-neoplastic form of the disease. So yeah, those patients who have lung cancer should be screened regularly for recurrence within the first 4 years of diagnosis and advised to stop smoking. Most patients can lead to moderately active lifestyle with treatment, but should avoid vigorous exercise because the voluntary contraction, it improves the symptoms, maybe because of the accumulation of the calcium inside the muscles also, and maybe repetitive nerve firing going to release more of the acetylcholine, so the improvement in the symptoms and increase in the strength of the muscle contraction. And avoid smoking and screening for the lung cancer. So that was all about the Lambert Eaton syndrome. It's not a must thing to know, but as a differential diagnosis of myasthenia gravis, it should be in your mind. Usually such cases are not handled by us, by the medical people, MD medicine people. So but just to have the knowledge, because the eye is involved, you should know, some basic idea about these conditions. Yeah, bye, good night.